BUZUD Air Compressing Nebulizer introducing. Component and parts showcase. Open the medication vial. Pour the medication into the medicine cup, according to the dosage prescribed by your doctor. Align the cover with the locking tabs. Place it on top and then twist it clockwise until it locks securely into place. Turn the dial on the top to adjust the mist output level. Fully open, half open, closed. Different fog output volumes for different gears. Hang the cup on the handle to prevent spills. Connect the tube to the air outlet. Then attach the other end to the medicine cup. Attach the mask or mouthpiece to the outlet port on the medicine cup. Place the nebulizer mask over the patient's head, ensuring it covers the nose and mouth completely. Turn on the switch. 2 Atomization methods, with mouthpiece with mask, after nebulization is complete. Fully separate all the parts. Submerge in warm water for 15 minutes, or rinse with purified water. After cleaning, all accessories need to be left to dry before storage. For the washing and care methods of all accessories, please refer to the user manual. Typically, air filters should be replaced every 3 months. If the filter has changed color, replace it with a new one. Do not attempt to wash or clean the filter. If you notice the filter is wet, please replace with a new one, otherwise it may cause blockages. BUZUD Reimagine Healthcare.